Well, today, we're diving into fetal alcohol spectrum disorders, or FASD, a complex group of conditions that can affect individuals exposed to alcohol before birth. Understanding FASD is crucial for prevention, early intervention, and improving the lives of those affected. The sole cause of FASD is prenatal alcohol exposure. When a pregnant woman consumes alcohol, it crosses the placenta and reaches the developing fetus. Because the fetal liver is not fully developed, it can't process alcohol. This exposure can have devastating effects on the developing brain and body. Alcohol interferes with normal fetal development in several ways. It disrupts cell growth, migration, and differentiation in the brain and other organs. This interference can lead to structural brain abnormalities, neuronal damage, and impaired neural connectivity. Alcohol exposure also impacts the development of the heart, kidneys, and bones. The severity and specific effects depend on the amount, timing, and pattern of alcohol consumption during pregnancy, as well as genetic and environmental factors. FASD affects people worldwide, but the exact prevalence is difficult to determine due to varying diagnostic criteria and reporting methods. Estimates suggest that FASD affects between 2 to 5% of school-aged children in the United States and Western Europe. Certain populations, such as those with limited access to healthcare or those with high rates of alcohol consumption, may experience higher rates of FASD. The signs and symptoms of FASD are incredibly diverse and can vary widely from person to person. They can range from subtle learning disabilities and behavioral issues to more severe physical and cognitive impairments. Common features include facial abnormalities, such as a smooth philtrum, thin upper lip, and small palpebral fissures. Individuals with FASD may also experience growth deficiencies, intellectual disabilities, attention deficits, hyperactivity, difficulties with social skills, and problems with judgment and impulse control. Diagnosing FASD can be challenging due to the wide range of symptoms and the lack of a definitive diagnostic test. A comprehensive evaluation is necessary, including a thorough medical history, physical examination, neurodevelopmental assessment, and behavioral observations. Information about prenatal alcohol exposure is crucial, but often difficult to obtain. Diagnostic criteria such as the Revised Institute of Medicine criteria, the 4-digit diagnostic code, and the Canadian guidelines can aid in the diagnostic process. FASD is an umbrella term encompassing several specific conditions, including fetal alcohol syndrome (FAS), which is the most severe form and involves distinct facial features, growth deficits, and central nervous system problems. Alcohol-related neurodevelopmental disorder, or ARN, refers to neurodevelopmental impairments caused by prenatal alcohol exposure, without the characteristic facial features of FAS. Alcohol-related birth defects (ARB) involves physical birth defects related to prenatal alcohol exposure. Partial fetal alcohol syndrome (PFAS) is diagnosed when some, but not all of the features of FAS are present. There is no cure for FASD, but early intervention and comprehensive management can significantly improve outcomes. Treatment focuses on addressing specific symptoms and needs, and may include educational support, behavioral therapy, speech therapy, occupational therapy, and medication to manage associated conditions such as ADHD or anxiety. A supportive and structured environment is crucial for individuals with FASD to thrive. The only way to prevent FASD is to abstain from alcohol during pregnancy and while trying to conceive. Women who are pregnant or planning to become pregnant should be advised about the risks of prenatal alcohol exposure. Public health campaigns and educational programs play a vital role in raising awareness and promoting alcohol-free pregnancies. Screening and intervention programs can also help identify and support women who may be at risk for alcohol-exposed pregnancies. The prognosis for individuals with FASD varies widely depending on the severity of the condition, the presence of co-occurring conditions, and access to support services. Early diagnosis and intervention can significantly improve outcomes, leading to greater independence, improved academic performance, and enhanced social skills. Recent research is exploring potential therapeutic interventions targeting specific brain abnormalities and cognitive deficits associated with FASD. Studies are also investigating the role of genetics and epigenetics in influencing the severity and expression of FASD.